Welcome dear students in another session. Myself Darshana Sandeep Shinde from Kekewag Institute of Pharmacy, Chandori, Nasik. Our today's discussion point is scope of pharmacology. Let's start our discussion or topic. Learning outcomes of our today's session are students should be able to understand the concept of pharmacokinetic, pharmacodynamic, therapeutic index, pharmacotherapeutics and toxicity. Let's start our session. First of all, we see what is meant by pharmacology. The term pharmacology has been derived from the two Greek words. Pharmakon means a drug and logos means a science. It mainly deals with the effects of the drug on the living body. Another one definition which explains the pharmacology, that is, pharmacology can be defined as the study of interaction between the drug and biological system. It includes the knowledge of the history, source, biochemical, physiological effects, mechanism of action, and therapeutic effects of the drug. That means, in a simple words, pharmacology is the science of the drug. But this cannot explain all about the pharmacology. It can be also defined as the study of interaction between the drug and biological system. That means what happened between the drug and the biological system. It mainly involves the history of that drug, source of that drug, biochemical and physiological effects of that drug, mechanism of action of that drug, and therapeutic uses of the drug. Then next one is drug. What is meant by drug? We see the different definition in our subjects, different subjects, physics, chemistry. But in terms of the pharmacology, drug causes the change in the physiological and biochemical functioning of the organ. Thus, the drug is defined as the substance used for the diagnosis, cure, prevention of the disease. This is the definition of the drug, which can be a little bit different to the different subject. In terms of pharmacology, it mainly involves, or it mainly about the what can changes it can because of the drug happen to the physiological or biochemical functioning of the organ. Then next one we see the pharmacokinetics. What is pharmacokinetics? Is the what is the body does to the drugs, like how the drug is absorbed, distributed, metabolized, excreted by the body. These four pharmacokinetic properties determine speed of the onset of drug action, intensity of the drug's effect, duration of drug action. That means absorption, distribution, metabolism and excretion decided the speed of drug action, intensity of drug effect and duration of drug action. Thus, from the entry of the drug in the body until its excretion, it is all about involved in the pharmacokinetic. The study of what happened to drug in the body is known as the pharmacokinetics. Firstly, drug undergoes the absorption, then it undergoes the distribution, then it metabolizes, and lastly, it undergoes the elimination throughout the body. This is the diagrammatic representation where we understand the principle of ADME, that is absorption, distribution, metabolism and elimination or excretion. Firstly, when medicine we take the medicine, it undergo the absorption. How will it get in our body? Then second step is distribution. Where will it go distributed in our body? How will it transport? Then metabolism, where is it is metabolized, how it is broken. And last one is excretion or elimination. That means how the drug leaves our body. That all study involved in the pharmacokinetics. This is the diagrammatic representation which gives a clear idea about functioning of the pharmacokinetic and pharmacodynamic. Firstly, we see the pharmacokinetic. When we take in the drug dosage, it undergoes the absorption, then it gets distributed in all over the body in our body, and after that it gets metabolized, and after metabolism it undergo again distribution and lastly excreted throughout our body. Then pharmacodynamics. In pharmacodynamics there is a concentration at the site of action and mechanism. This is mainly involved which we will get from the distribution and vice versa. And because of this concentration, we get the specific therapeutic effect. Because of the therapeutic effect, we also have some side effects, or we also said that this side effect because of the drug available at the site of action. Then next, we see the pharmacodynamics. It deals with the study of mechanism of action and pharmacological effects of the drug. That is, it is the study of how drug affect the body. The study of what happened to the body due to the drug is known as the pharmacodynamic. That means how the drug, when drug enter in our body, what happened to the drug. That is, pharmacodynamic is what drug does to the body. Then therapeutic index, it indicates the relative margin of safety of a drug. A dose of a drug which produces the stated effect in a 50% of individuals within the population is called as the median dose. Depending on the stated effect, it can be designed as the median effective dose, that is ED50, and medium lethal dose. And therapeutic index is calculated by the formula. Therapeutic index is equal to LD50 upon ED50. ED50 means how much 50% of people get stated effect, what for what reason we can take these trials, and if 50% of people get where stated effect, it is known as the ED50, and 50% is lethal dose. That means they do not reply. A drug with a larger therapeutic index is safer than one with the smaller therapeutic index. Hence, the drug with the lesser therapeutic index should be administered cautiously. That means we have to choose drug with the larger therapeutic index. Then next one is therapeutics. What is meant by therapeutics? In a Greek, it means art of medicine. It means any measure which is taken in the treatment of the disease. Therapeutics has many branches: physiotherapy, psychotherapy, radiotherapy. One of its branches is pharmacotherapy that utilize the drug in the treatment of the disease. That is therapeutics. That means what treatment or what medicine do you take for the some disease. Then pharmacotherapeutics, the study of drug in relation to their application in the treatment of the disease, is known as pharmacotherapeutics. That means in a pharmacotherapeutics we study the, or we discuss about the study of the drug in relation to the application of the drug for the specific treatment. And therapeutics means only the medicine which is taken for the treatment of the disease. Then toxicology, it is the study of action of overdose of the drug which endanger or dangerous or dangerous to our life. Strictly speaking, it is the study of the poison, their effects and treatment. That is, if we take the poison in an appropriate dose or appropriate manner or in a potent manner, it should be as a behave like a medicine. Or if we take the medicine in a large quantity, it will be give the toxicity. Then chemotherapy, the use of the chemical agent in the treatment of the disease is called as a chemotherapy. These agents destroy the infection without damaging the human body. That is the use of some kind of chemical agent for the treatment of the, or for the destruction of the infection is called as the chemotherapy. Then pharmacopoeia. Pharmacopoeia is the official book that containing the selected appropriate list with the details of the physical, chemical properties, test of their identity, potency, etc. Pharmacopoeias describe the standards which must be contained in these preparations. The well-known pharmacopoeia in the field of the pharmacy include British Pharmacopoeia, United States Pharmacopoeia, Indian Pharmacopoeia, International Pharmacopoeia. Other than some books, besides this, some books are also in the market. National Formulary, then British Pharmaceutical Codex (BCP). These are from this we get the official information of the drug of different countries. Then next we study the or discuss about the source of the drug. Drugs are the used today to are obtained from the various sources. First one, we get the drug from the plant source. Various plant extracts are developed into the drugs, that is the morphine, digoxin, reserpine, then vinblastine, that is anti-cancer drug. Then apart from the plant source, there is also animal source. Animal hormones and their glands secretion are used in the certain disease condition to cure them. Example of drug from the animal sources are insulin, heparin, thyroid extract, etc. Then next source is mineral source. Certain minerals are useful as a mineral agents. They include the liquid paraffin, magnesium sulfate, kaolin, etc. These all we get from the mineral source. The next source is synthetic source. Nowadays, a large variety of drugs are made synthetically by the chemical interaction. Example of its aspirin, sulfonamides, corticosteroids, are which are prepared from or we get obtained from the synthetic sources. And last one is the from the microorganism. Certain drugs like antibiotics are obtained from the microorganism by the fermentation process. Example of its penicillin, rifampicin, etc. The next one is nature of the drug. We get the different we study the different sources, but what the nature of the drug? Majority of the drug used in today practice are of synthetic origin. They are prepared from the interaction of various chemicals. The drugs from the plant origin contain the pharmacologically active principle present in the plants. So we discuss about the nature of the drugs. First one is alkaloids, morphine. Example of its morphine, atropine, imidine. The next class of drug that is the glycosides. Example is strophanthin, digitalis. The next class is the oils. Oil, in oil, first one is a fixed oil, such as olive oil, castor oil, cod liver oil. In oil, there is a second part is the volatile oil, such as the eucalyptus oil, turpentine oil, clove oil. Then the fourth type or nature of the drug is resin. Example of its oleogum resin, which are obtained from the ginger, asafoetida. Then gums. Fifth one is the gums, that is the agar, acacia, tragacanth are used as a pharmaceutical aids. These are the gums. Then sixth one is the tannins. Example of tannins, catechu. In that tannic acid is present. This is all about the nature of the drug. Thank you. Thank you very much for listening me. If you have any queries, then contact me. This is my mail ID.